Hi, I'm Dr. Chuck with Your Filthy Mouth. Today, we're going to be talking about hospitals and dentists. Why don't they have them? Stay tuned.
Your smile is beautiful and possibly deadly. Dr. Chuck is here to tell you how your mouth can hold the key to your overall health. Now, about that filthy mouth of yours.
Hello, and welcome to Your Filthy Mouth. I'm Suzanne Lynn with Dr. Chuck. Hello, Dr. Chuck. How are you today?
I'm doing good.
It's storming, so we might hear some thunder
That could be
here
exciting.
in Central Florida, yes. It just punctuates the importance of this topic, and we're going to be talking about hospitals being tied in with dentists. And your intro was intriguing. Why are there not dentists in hospitals?
That's a really good question right there. If you look historically, going all the way back to 1934, there was a physician that wrote a really good article to the Journal of the American Dental Association magazine. And in it, he says that all diseased teeth should be removed, even if they don't have any pain, because this is the source of many of the bodily diseases that we have.
Okay, that was 1934?
Yep.
All right.
In the year 2000, the U.S. Surgeon General wrote a large, it was a 232-page report on oral health in America. And in that, he basically says that you cannot have a healthy body with an unhealthy mouth. I mean, this is the front door to your whole body. This is where the bacteria is coming in.
Right.
This is now 2019. And how many hospitals that you know have a dentist? Not many. And I've been debating for a while whether I'm going to share my experience or not. And it's come to the point where I have to share it.
Right.
Because this is not about me. This is about health. This is about you. This is about this medical crisis that we have in our country that we seem to be putting Band-Aids on instead of dealing in. Here's my story.
Okay.
I spent 4 days in our local hospital as a patient. I picked up a bug in a plane, and I was going downhill. So when I went to the emergency room, the first doctor looked in my mouth, and I asked, "What are you looking at?" Well, the tongue in the back of the throat, looking for swelling and redness and problems like that. Okay. I said, "Well, you're looking right past the biggest polluter of the bloodstream." And she kind of looked surprised. "Really?" And so in the 4 days that I was there, I asked every doctor, nurse, administrator, anybody that I could, is there any link between the health of the mouth and the health of the rest of the body? No, news to me, didn't know that. I got to one cardiologist. He was like, "Absolutely, there's a big link on that." Well, I figured one doctor in the hospital is not enough. We need more. So I thought, wouldn't it be great to do oral examinations on the patients lying in their beds, because everything we need to do in oral examination is portable. You can take x-rays, they're portable. You can do periodontal charting. There's a lot of things you can do without having to go to the dental office, but you can do it in oral exam.
Okay.
So I brought that idea to the hospital, and I applied to be on staff with them. And my first letter of rejection said that I was not certified by the American Board of Dentistry, and that only 1% of the dentists are. I had to point out to them that there is no such thing as the American Board of Dentistry.
Are you kidding?
I have
They
the
wanted
letter.
you to be certified by something that doesn't even exist.
Every state has their. We're in Florida, so there's the Florida Board of Dentistry. Every state has their. There is no American Board of Dentistry. Okay. So you're right. When I pointed that out to them, okay. Well, we're sorry. So reapply.
That's
so
concerning. I'll be honest with you. That's concerning right there.
I reapplied, and they had. Well, you have to take these courses. I jumped through the hoops. When it came down to the final meeting that we had, there was 10 or 12 doctors and myself. And we all agreed that, yes, the mouth plays a role in our overall health. Yes, the bacteria get into the bloodstream. Yes, there is a role. But their final decision for not wanting to have a dentist in the hospital was if they were not able to treat it, they did not want to diagnose it. So I explained to them every week, I diagnose things that are beyond my capabilities to treat. So I refer that patient to a specialist or someone who can treat that. And their answer is, we do not want to be in the referral business. So my question is, are you there for the patient or are you there for the profit? Mm-hmm. And the longer this goes on, I'm becoming more angry with it, because our goal is to let's do what's best for the patient. That doesn't mean I have to do it.
Right. You're saying have a dentist in there that can diagnose what's going on. Is it a stretch to say that some of the things that they're being treated for, high blood pressure and heart, is related and they're just putting a Band-Aid on it? Is that what you're saying?
If you're only treating the symptoms, you're never going to get to the source. And many times the source is literally right under your nose.
Right.
It's the mouth.
Right.
But 90% of dental infections have no pain. So how do you know what's going on?
Right.
The physician in medical school was not trained to take care of the mouth or to do even a thorough oral examination. They were trained. The dentist has that covered. Don't worry about it.
Wow.
But the trouble is, we have a bloodstream that goes through the entire body. So whatever blood goes through the mouth and picks up bacteria, picks up toxins, picks up other problems from the mouth,
Sure.
it's distributed through the entire body.
Because
that includes the
bloodstream.
heart,
Right.
the brain, the pancreas, all of these things. They've shown that 50% of heart attacks are triggered by oral infections. 90% of oral infections have no pain. Physicians aren't asking about the mouth because they weren't trained to. And I'm not blaming the physicians. They
Right.
weren't trained to. But I'm not practicing dentistry anything like I practiced in 1979 when I graduated dental school.
Right.
We've learned a lot of things. My education has continued every year, just like a lot of physicians' education has continued. But for some reason, we're not connecting the dots between the mouth and the rest of the body. And it's time that either the physicians can explain why they're not doing it, or the hospitals can explain why they're not doing it. And I think it's only a matter of time, because if you think about cigarettes, if you look at in fact, it's interesting, you look at cigarette ads in the late 50s, early 60s, and physicians are actually recommending cigarettes. You know, so
Fred
you look,
Flintstone's promoting them. Yeah.
you look
right,
back and you
right.
say, that how stupid was that? Well, that's what they knew at the time.
Right.
Well, what are we being told now that we're going to look back in 20, 30 years? And can you believe that's what they were telling them?
Right.
So,
right. What did it take? What changed? What was the turning point for that?
well, for cigarettes, a lot of it had to do with lawsuits. Once there was these massive lawsuits against the tobacco industry, then it seemed like cigarette smoking became a little less sexy. It wasn't as accepted as it was. Now it's you have no smoking places, and
Sure.
it's not cool to smoke anymore.
Right.
It used to be cool.
So lawsuits, is that what it's going to come down to with us?
I wish it didn't have to come down to
Right.
that. But when attorneys figure out that, gee, the Surgeon General has told everybody that you have to have a healthy mouth, and that hospitals are not even allowing. Now, let me back up. There are some hospitals that have dentists in them. There are some hospitals that have a whole dental department. There are some hospitals that are actually doing what's best for the patients,
Right.
which is wonderful.
Right.
There are some fantastic physicians out there. But there are others who, I don't know if they just are afraid that if they get to the source that they might not have a patient for life. I don't know what the motivation is for not including the mouth as part of the body. So that's my why I'm getting angry, because we have to include the mouth. This is a source. The research has already been there. This is not my research. I'm just a messenger.
Right.
But I've seen it in my practice. I've been practicing for 40 years. I've seen people with a lot of medical issues that have some dental issues. As soon as you take care of their dental issues, oh my gosh, they're off half their medications.
Can you give us an example? Because that is so powerful to hear that.
I have one patient in particular that she came in, she was on dialysis. They were having trouble unhooking getting her to stop bleeding when they had unhooked the dialysis. Her medications were not working like they were supposed to. She was almost lethargic. She had no energy at all. She was
Sad.
an artist. She hadn't wanted to draw for 2 years. Now remember, she'd been seeing physicians on a regular basis. She came into me as a new patient because finally one of her teeth started hurting. Suzanne, you didn't have to have DMD by your name to look in her mouth and say, oh my gosh, that is a disaster.
Wow.
So we looked at her mouth. We ended up taking out all of her teeth except for 2. We were able to save 2 on the
my
bottom.
gosh.
So our treatment was antibiotics to get the infection under control,
Okay.
removing the bad teeth, and within 3 weeks, just by getting the bad stuff out of her, within 3 weeks, no more problems with the bleeding on the dialysis. The medications were working good. She had pep in her steps. She wanted to draw again. Her whole life had changed.
Wow.
That's one example. I've had many others over the years where once you get the mouth healthy, these other problems seem to certainly decrease or sometimes disappear. So we have to include the mouth as part of the body.
So what do we do? How do we get the word out? What can someone who's watching this do to try to help with communication?
Well, there's a few things. Number one, if you're in the news industry, why don't you get the hospital's point of view? Why don't you ask them? Go interview them. You're hearing my side of it. Why don't you go talk to them and ask them, why don't you have dentists in here and see what they have to see what their answer is? You know, maybe they have a good reason. I haven't heard it, but maybe they've got a good reason for it. I know they're not set up to treat it, but that's okay. You can refer. In our area, we have some excellent dentists.
Right.
You know, you can refer out. Well, does that mean you lose the patient? Not necessarily. It means that you're doing what's best for the patient.
Right. Tell me it's not coming down to the money. All right. Well, we need to get the word out.
Yeah,
and find out what they have to say.
So
Yeah.
if each person would ask their physician, is my mouth important for my overall health? Were you ever trained that? You know, what are your thoughts on how the mouth affects the rest of your body? You know, we've got to start asking our questions. We have to be our own advocates.
Right.
And just because your mouth doesn't hurt does not mean everything is healthy inside your mouth. And that's one of the biggest things right there. Lack of pain does not equal health.
Right.
High blood pressure, diabetes, glaucoma, and cancer. No pain, but they're not healthy. So if we can, you know, start with your own physician. But if you are in the news industry, why don't you ask some hospitals and see what their answer is? I know our local hospital here, if we can't treat it, we don't want to diagnose it. That just, to me, is it's almost immoral, in my opinion. This is my
That's
opinion.
powerful. That's strong.
Yeah.
Yeah, absolutely. When I go to my physician, my general practitioner, I always try to bring up the topic about, you know, is it possible that maybe I'm fevered because of something that's going on in my mouth? And I mean, he's actually turned to the show and watched some of the episodes before.
That's
so it's really
fantastic.
just about education and just being brave enough to go, you know what, I'm the spouse of a physician. I saw something interesting today. Let's talk about the correlation between the mouth and the rest of the body.
Yep.
You know?
Yep. I had a patient just this last week talk with their infectious disease doctor and ask them, does the mouth have anything to do with infections going on in the body? And the physician was not, oh no, he was like, well, you know. We have to be more than that.
Yeah.
We have to say, yes, this is a pathway. This is the front door. This is where bacteria can get into the body and really affect it. You got three things from the mouth. You've got the bacteria from either tooth infections or gum infections. You have the airway, which is a big deal. So many people have sleep apnea, and it seems like the only option they're given is a CPAP. Well, that is a great option if you have sleep apnea, but if you're not going to wear the CPAP, you've got some other options. There's some oral devices you can use. And you have the bite, the way the teeth come together, because that can cause headaches, neck aches, other things like that. So you know, those three areas right there, we're not talking about smiles or chewing or speech. We're talking about things that go beyond the mouth.
All right. Well, it's time for question of the week, and we've got Kathy coming up next.
Here's Dr. Chuck's question of the week.
Hey, Kathy here. What's the best technique to floss?
Okay, great. Thanks, Kathy. We're going to send you a mug, by the way. We just got these in your filthy mouth mugs. And if we use your question on your filthy mouth, I can't say it, but I mean it. We are going to send you a mug if we use your question.
Absolutely.
So anyway, good question. What do you say?
What's the best way to floss? How do you know you're flossing good?
Right.
Well, again, I am not hung up on technique. I'm hung up on results. And so the trouble is when most people floss, they're really not flossing, they're popping. Popping is when you take the floss in between the teeth, you wiggle around a little bit, you take it out, you go to the next one, you pop it around, wiggle around a little bit, take it out. That's popping.
Okay.
Flossing is when you go in between the teeth, you wrap the floss 180 degrees around one of those two teeth, just slide the floss up and down several times, then you wrap it around the next tooth, slide it up and down several times, and then you take it out and go to the next spot. That takes a little bit of extra time. It takes a little bit of dexterity. You got to get your fingers in your mouth. I mean, it does take. And no matter what technique you're doing, this is why I'm such a big fan of the disclosing solution, disclosing tablets. Check yourself. Did you do good? And this way you can find out if you did a good job or if you did an other than good job.
Okay, awesome. Thanks, Kathy. As we wrap up today's show, we're talking about the correlation between dentists and hospitals. What are some of the final thoughts, Dr. Chuck?
Well, I think that we need to include the mouth as a part of the body. The same blood that goes through the mouth, that goes through the gums, that goes through the tongue, that goes through the teeth, that goes through everything, goes through your heart, goes through your brain, goes through your pancreas, goes through everything in your whole body. So if you're picking up bad stuff, I don't care if it's in your foot, your hand, or your mouth, if you're picking up bad stuff and you're distributing it through the rest of your body, that needs to be of concern to all healthcare professionals. And that's the question. Are you going to be a pill pusher or a healthcare professional? Are you going to be a tooth mechanic or a healthcare professional? Are you going to be a tooth scraper or a healthcare professional? And hopefully we want to be healthcare professionals. And that includes physicians, dentists, and all of those others that are working on us to have better health.
Well said. Thank you. Share this information and subscribe. We want you to get more shows. But most importantly, and Dr. Chuck, you're so passionate about this, please share this. You are just the messenger. Talk to your physician about this. Talk to your friends and family, right?
Well, that's why on the website we've got all these different references. I'm not making this stuff up. You can go right to the research. You can go to the studies. You can see who's actually doing the studies.
Right.
And it's incredible when you look at it. You may start scratching your head and say, why haven't I heard this before?
You heard it here. Your Filthy Mouth. Thank you, Dr. Chuck.
This has been Your Filthy Mouth, a weekly podcast about how what happens in your mouth affects the rest of your body. This is important information, so please share it with your friends. Don't forget to hit the subscribe button on YouTube, iTunes, and all the other podcast sites. And drop by yourfilthymouth.com to ask Dr. Chuck a question or find dozens of links to information about oral systemic health. We'll talk to you next week.